Hi, my name is Dr. Ruiz-Mendoza, and I'm one of the consultant geriatricians working at Peterborough City Hospital. I want to say thank you for voting for my poster and giving me the opportunity to make this presentation about Parkinson's disease in a rehabilitation unit during the first lockdown. Thank you. So welcome to the presentation, Parkinson's disease in a rehabilitation unit during lockdown 1.0. So first of all, I'm an interface geriatrician. And when my son asked me what type of doctor is that, I always answer that I'm like an Ankh. Ankh is the last airbender, and Ankh can control the flow of the air, water, fire, and earth. And Mam can control the flow of Parkinson's patients' journey amongst the acute rehabilitation and clinics. So first of all, the country first went into lockdown on the 23rd of March 2020. People stopped attending hospitals for fear of contracting COVID-19. As an interface geriatrician, I saw an 18% of reduction of admissions of Parkinson's patients in the acute settings. A 77% of clinics were canceled, and in my case, all my clinics were canceled. But I didn't know the numbers from the inpatient rehabilitation unit. So this MasterClass project gave me the opportunity to examine the use of our rehabilitation unit during the first lockdown by the Parkinson's patients from our local Parkinson's services, to describe some of the demographics of Parkinson's patients admitted to a rehabilitation unit during the first lockdown, and also took the opportunity to review the impact of our rehabilitation intervention on the long-term mortality in our Parkinson's patients admitted in a rehabilitation unit. So I reviewed the Parkinson's patients admitted to our 36-bed inpatient rehab unit admitted during the first lockdown period from March to June 2020, and compare it to the Parkinson's patients admitted in the same period in 2019. I review some of the demographic characteristics, such age, length of stay, length of the disease, and provenance, and I look into the mortality rates at 6 months after discharge. But even with my avatar superpowers, it was not easy. We don't have coding systems, so the Alexa, give me the number of Parkinson's patients admitted in my unit, doesn't work. So I review each of the patients admitted in our unit with diagnosis of Parkinson's disease one by one, and I'm talking about 130 patients per period, so a total of 260 patients to determine which of them had Parkinson's disease. We have patients from different areas and different Parkinson's services, so I don't have access to their records. So my project was limited to our local Parkinson's services, reducing drastically the sample of the site. So each of my results, we could hypothesize, but it's not, they don't have significant statistic significance. So we went to the second lockdown as well, and I was working nearly 7/7, so the time I had to invest in the project was nearly non-existent. But I managed to have some results, and what results? The number of admissions of Parkinson's disease remained stable during the first lockdown, representing the 2% of the total. It will be interesting to see if other rehab units, they have as well the 2% of admissions, they have Parkinson's disease. As well, patients admitted were younger during the lockdown, but with more advanced disease, with a mean of 12 years with the disease. The mortality at 6 months' time of patients admitted during the lockdown was the catastrophic rate of 66% when compared to the same non-pandemic period with a 0% of mortality. The provenance from the community increased with the reduction of admissions from hospital. And the patients with the Parkinson's symptoms during the inpatient rehab admission were multiple as expected in this type of patients, but I didn't look through it. So with these results as a discussion, I could hypothesize that the rate of admissions during the first lockdown were stable compared with the same period last year, with a total of 2% of patients with Parkinson's disease. However, the provenance was more from community and with a more advanced disease. We could say that only 3 months of lockdown was enough for physical deconditioning and the need to be admitted in inpatient rehab facility with patients with advanced Parkinson's disease more at risk. So it will be important to explore how a second prolonged lockdown has impact on patients with Parkinson's disease. Another question, it could be, does the rehabilitation program impact in Parkinson's mortality? Well, with a 66% of mortality at 6 months' time, we could hypothesize that our rehabilitation intervention did an impact in the mortality, supporting the recent studies that Parkinson's disease is an independent risk factor of mortality during COVID-19 pandemic. However, when reviewing the mortality in the same non-pandemic period, the mortality at 6 months was 0%. Fantastic results if we take into account the average age of patients was 82 years old. So maybe we are kind of useful for Parkinson's disease. So what is next? I will say that the next steps will be myself to explore the use of the rehabilitation unit by Parkinson's patients during this second lockdown. And I can say that I presume that they will be completely different from the first lockdown. I think that this second prolonged lockdown impact more in the condition. I mean, and I can see nowadays more patients with Parkinson's, so I'm waiting to finalize this second lockdown to look into the numbers. And as well, I will say that we should now to move in a collective next step, maybe, should be an urgent need to identify strategies from all settings to reduce the higher mortality rates of Parkinson's patients during the time of pandemic. As you can see, 66% of mortality is a huge, huge number. So I know now that patients with Parkinson's disease admitted in my rehab unit, they will have more chances to die in the next 6 months during a pandemic time, comparing with the 0% when there was not such a pandemic days. So if we move to another lockdown or to a worse phase of the pandemic, we should be work together to analyze which is the best way to deal with patients with Parkinson's to try to avoid such a huge mortality. And to do this, I think that we cannot do it alone, and we should be working all together. And I think that this masterclass is a huge opportunity to meet all us and to think about, you know, all of us in independent areas that what we are working through the Parkinson's patient journey, to see how we can work together, how we can put our brains together, and to analyze which are the pathways or the interventions that we should do, you know, to avoid the such amount of, you know, the high rate of mortality in these patients. And we can do it if we work together. So if I can help you in any way, please contact me, as I'm interface geriatrician, and as you can see, I have superpowers. Thank you.